Workflow is any process that occurs in a healthcare system. Workflow is a dynamic, moving process that crosses different levels of the organization. It is essential that workflow be considered in the development of all healthcare information technology systems, and that mechanisms for testing and evaluating workflow can be built into the system's design. The same incentives that encourage the use of health information technology also produce its biggest challenges. While widespread use of health information technology improves communication and can lead to a more efficient and safety, as we've previously identified, the systems may be cost prohibitive, can actually decrease communications if the systems are not interoperable, and user satisfaction and patient safety are directly related to the individuals using the system. Workflow is the method by which work occurs. Workflow can be supported or hindered by the health information technology. Workflow should be evaluated as a part of the planning and the design of information technology and should be measured in terms of productivity and evaluated for the need to redesign any inefficient aspects of the system. Many factors influence workflow, including the person using the system to complete the work, the task being accomplished in the system, the technology, and how well it is matched to the task, and the physical environment where the work is being done. For example, if the individual is not familiar with the technology, the task is not well outlined in the design of the program, the technology is complicated or not easy to use, and if the physical environment is not conducive to completing the work within the program, workflow is hampered. Workflow also varies depending on the discipline and the type of work being done. Workflow analysis begins with deciding what is being evaluated, the task, the interaction, or the exchange of information, and then reaching out to observe the work being done and interviewing or requesting completion of a questionnaire by the user to evaluate satisfaction and to seek identify factors that impede the accomplishment of the task. The process of analyzing workflow begins when the system is being designed. The processes are designed for the discipline using the system, and since the workflow of nurses in inpatient hospitals is probably the most chaotic of all in healthcare, it is essential that nurses are involved in the beginning as the system is being designed. At the onset of design, each task is identified and organized in the system. Your text shows an example of how the workflow-oriented framework of health information technology can be implemented following a flow diagram. Human factors must be considered when analyzing workflow. Common impacts include switches, which are identified as changing from one task to another, often abruptly. Workflow interruptions cause an abrupt switch between tasks that can lead to error. The most common and high-risk interruption of nursing care are those that occur during medication administration. One study of medication administration interruptions found that nurses were interrupted on the average of 1.2 times per medication pass. Walking is an integral component of all patient care. Nurses who work 12-hour shifts walk an average of 5 miles each shift. Nurses walk to respond to calls, administer meds, find equipment, and make rounds. Many other factors impact workflow, including the physical environment, the organizational characteristics, and each of these interact to influence clinical workflow. While there are many tools that help in the workflow analysis process, the three main ones that nurses need to be familiar with are task analysis tools, process mapping tools, and data display tools. When analyzing tasks, a list of the activities to be evaluated is made, and then observations are made of individuals performing the task from the beginning steps to completion of the process. Usually the task is measured in terms of time to completion and incidence of interruptions. To examine a process, flow diagrams are typically used to identify the steps. There are some common symbols used to create a flow chart. These are identified in your text. Finally, data display tools involve displaying data in a form that makes the information easy to read and informs staff of the progress toward completion or meeting of a goal. Your text shows examples of data display tools. A force field analysis is completed to identify the issue surrounding a change. When conducting a force field analysis, driving forces and restraining forces that may prevent a goal from being reached are examined. If the team can increase the driving forces and eliminate or diminish the effects of those forces that can prevent reaching the goal, then the change is more likely to occur and be successful. Your text shows an example of the forces that impact the implementation of an electronic health record in an ambulatory care setting. A gap analysis is a formal report of the analysis of a current, often inefficient workflow and the future desired workflow. The inefficiencies represent the gap between the current workflow and the desired workflow. An example of a gap in workflow occurs when nursing staff document vital signs on paper and then later transfer that information into the electronic record. This transcription is redundant and opens the documentation to error if the transcription is not accurate. To close this gap, the workflow needs to be redesigned so that documentation in the electronic record occurs at the time the vital signs are taken. One way this can happen is an upgrade in the vital sign equipment so that it communicates with the electronic record to automatically enter the vital signs into the electronic record. Workarounds occur when nurses or other healthcare providers find that a process is cumbersome, time-consuming, or that it just doesn't work for them as they provide care. However, workarounds raise the risk of error and must be analyzed, and processes need to be corrected to account for the inefficiencies to avoid errors. Clinical decision support systems are integrated into the electronic health record to improve the efficiency and safety of care processes. In order for a decision support system to be effective, the workflow must be understood and mapped using a flowchart. One of the most familiar tools to support decision-making are the computerized alerts and reminders that are embedded into the medication administration and the electronic health record systems. Availability of clinical guidelines, population-specific standardized order sets, documentation and report templates, diagnostic support systems, are other support tools that provide healthcare workers with relevant information to assist in care-making decisions. Analysis of workflow processes contribute to the outcomes of patient care that the Institute of Medicine's Crossing the Quality Chasm report indicate. Patient satisfaction with their experiences in the healthcare system can be evaluated by how well health technology helps with timeliness and efficiency of care delivery. If information can be communicated in a way that allows for a seamless transition of care from the hospital to the outpatient setting, and then satisfaction with care is further improved. Human resources programs include billing systems, those that assign nurses to units and admitted patients to units, or to a particular nurse's assignment based on unit and nurse workloads. Systems that help disperse materials to organizations and units with respect to cost and efficiency are also important to workflow. In summary, the electronic health record is an integral part of meeting the Institute of Medicine's quality initiatives, and nurses' participation in the development of informatics systems and workflow design is critical to improving the quality of care.